Good morning, everybody. Welcome to the Joint Education and Culture, Health and Human Services, and Public Safety Committee meeting to talk about a very, very important issue. We have three panels today. This is to address the rise, the really tragic and unacceptable rise that we would all agree in the use of fentanyl and opioids with our youth. This isn't the first conversation, but this is important in the council context that we're bringing together three committees that this touches on. Obviously, it impacts every committee and all the work that we do here. And we have three panels to talk about it. I want to thank everyone for being here. I want to thank those that are watching. I want to thank all of our advocates. I want to thank my co-chairs, who I'll turn to shortly. Anytime someone is impacted by an overdose, particularly our youth, it impacts all of us in the community. It hurts us, we feel it every time, and we have a deeper and stronger resolve to make sure it doesn't happen again. We've seen, unfortunately, a dramatic increase in the rise of overdoses among our young people and in deaths over the last year. In large part, as we'll hear, connected to the rise in the use of fentanyl in many of these opioids. You've heard the stats, you'll hear them again. We had a 77% increase from last year to this year in overdoses for residents under 21. 48 youth overdoses last year, 11 which were fatal. Already this school year, 5 overdoses that have resulted in death from our MCPS students. We've all been speaking to students, and there was just a forum over the weekend. We've all been speaking to students in our capacity. My capacity as the chair of the Education and Culture Committee. I've been speaking with students and parents because the number one thing, in my view, that we can do, and a big part of today's session, is get the word out about the deadliness and the ubiquitous nature of these pills and of fentanyl. Some studies suggest that 6 in 10 of these pills are laced with fentanyl, which means the strong chance that if you take that pill, it's going to have something in it that could kill you in one dose. The goal of this session today is to build awareness and to discuss how our county is addressing it from a holistic standpoint, from the public health, from public safety, from the education standpoint, and how we're going to build upon that work that's already been done to have a countywide plan and approach to making sure that we don't lose any more of our children, and that the ones that need help get help before it's too late. This is an all hands on deck moment for us. We take it seriously, every one of my colleagues and the county executive and our community members. And so with that, we're going to have a full session. Just a couple of housekeeping remarks before I turn to my colleagues, and we'll start with Chair Albanaz and then Chair Katz, is that we will have about 1 hour for each panel. We have 3 hours. We're going to ask that you move through your presentations, and then we will pause at the end of the presentations and take questions. We'll start with DHHS, and they already know what they're doing because they're here. But before we do that, I want to turn to my friend and colleague, Chair of the Health and Human Services Committee, Chair Albanaz.